My name's Teddy Cook. I'm ACON's Acting Director of Community Health, and usually I'm Manager of Trans Health Equity. I'm also an advisor to Healthy Male, and my pronouns are he, him. In this video, I'll be providing an overview of trans health, and in particular, gender-affirming healthcare. You can find more information on the Healthy Male website, but let's get started. At birth, or even before, people are assigned a gender, either male or female, based on the appearance of their external genitalia. This classification of gender, although it's conventional, is inconsistent with the lived reality of some people. Some people, often known as trans people, experience a conflict or difference between their assigned gender and the gender that they know themselves to be. This experience may result in some specific healthcare needs for these individuals. Now, we don't know the exact number of trans people in our community, and that's people whose gender is different to what was presumed for them at birth. And this is because they aren't yet included in the census. Feelings ranging from discomfort to considerable distress are reasonable responses for the conflict that people can experience between what was presumed for them and who they know themselves to be. Not all people whose gender is different, though, experience gender dysphoria. Gender dysphoria is a diagnostic term. It's used by the DSM-5, by trained mental health professionals. Gender dysphoria itself can be the cause of psychological problems, and as mentioned earlier, it's certainly not experienced by all trans people. The discrimination and abuse faced by trans people may contribute to the higher rates of poorer mental health in trans people than we see compared to cis people. Trans people can experience social marginalisation and health inequity. Discrimination against trans people in many forms can occur when they access healthcare. This can cause trans people to delay or avoid seeking appropriate healthcare. Trans people may seek healthcare for various reasons, ranging from issues that are completely unrelated to their gender, through to the desire to access services for gender affirmation, particularly medical gender affirmation. Trans people appear to have higher rates of a variety of chronic diseases than cis people, but the cause for this is unknown. Fear of discrimination is a big barrier for trans people seeking medical care. So healthcare services and healthcare professionals are responsible for ensuring an environment and processes are inclusive of trans people. Healthcare facilities that are welcoming, inclusive and safe for trans people are essential to facilitate their presentation for care and return to follow-up. There are various practice design elements and procedures that contribute to establishing a practice that is inclusive of trans people. ACON offers support to assist health services to be welcoming, inclusive and safe, and you can visit ACON's Trans Hub to find out more. When working with Indigenous Australians, you may hear and use some different terms. Sister girl is a term used by Aboriginal and Torres Strait Islander people who have a female spirit and who take on female roles within the community, including looking after children and family. Many sister girls live quite a traditional lifestyle and have strong cultural connections and backgrounds. A brother boy is a term used by Aboriginal and Torres Strait Islander people to describe gender diverse people who have a male spirit and who take on male roles within the community. Brother boys have a strong sense of their cultural identity. The terms sister girl and brother boy can differ, though, between locations and countries and nations. The terms may not specifically define who someone is, but instead identify a fluid sort of affiliation that complements their identity. In Aboriginal and Torres Strait Islander communities, the terms sister girl and brother boy, with an A, are used for terms of endearment for women and men, respectively, with no specific reference to gender diversity. Most healthcare required by trans people, including most gender-affirming treatments, including hormone therapy, do not require specialist medical knowledge. Some trans people may benefit from multidisciplinary care, though, from GPs, mental health professionals, endocrinologists, sexual health physicians, surgeons, speech pathologists, and even social services, depending on the individual and what their circumstances are. General practitioners can be well placed to manage the healthcare needs of trans people, provided they're applying welcoming, safe practices and services that recognise and are inclusive of gender diversity. Initiation of gender-affirming treatments for patients from inexperienced GPs is usually performed by or in close collaboration with endocrinologist, a mental health professional. The Trans Hub website, though, is a great place to connect in around information that is specific for clinicians and the community. It also provides a directory for doctors providing gender-affirming healthcare. There's also a section of the website that supports clinicians to learn more about trans health and gender-affirming healthcare. Healthcare providers should try not to make assumptions about someone's gender identity. Patient information paperwork should include an option for patients to mark their gender as male, female, or non-binary. Simply asking a person's preferred name or pronoun, such as he or she or they, and their gender on a form or in a conversation is better than guessing. An important aspect of gender affirmation for some people is consistency with official documents. In Australia, reissue of official documents such as passports with a person's affirmed gender is possible, with support from a medical professional. Different Australian states have their own requirements and procedures for changing the gender that's marked on a birth certificate and other documents issued under their jurisdiction, driver's licences, etc. During the initial consultation, though, it's important to build trust up front. Take a complete history, assess the risks and identify what available social support is there and available for your patient. Reassure them. Gender incongruence and gender dysphoria are not pathological conditions, but they may be accompanied by mental health issues that do require attention. You will need to discuss this with your patients. And screening by a psychologist may be helpful, so is peer support. Trans people do have higher rates of suicidal ideation and self-harm than cis people, so appropriate screening, surveillance, and referral, if necessary, are important elements for their ongoing healthcare. Not all trans people will seek gender-affirming medical or surgical intervention, but may socially affirm their gender by using behavioural changes, such as altering their speech and clothing, chest binding or genital tucking to hide secondary sex characteristics. And this can result in bruising, skin irritation and pain, particularly if not performed correctly, so watch out for that. Many trans people seek medical intervention to achieve a physical affirmation of their gender, the most common form being hormonal treatment. Trans children may benefit from psychological support for the child and for their family, particularly if their family, school, or social environments are not as supportive as they could be. Generally, the mental health of children who can socially affirm their gender improves. For children with complicated circumstances or those experiencing significant distress, some support from an experienced specialist in child cognitive and emotional development will be useful. Medical treatment for gender affirmation is not recommended until later in puberty. For some people, the development of secondary sex characteristics during puberty can cause considerable distress, and many of these individuals desire intervention to affirm their gender. In general, gender-affirming hormonal treatments are not used until after 16 years of age. What we do know, though, is that treatments for trans adolescents are safe and effective. The Australian Pharmaceutical Benefits Scheme does not currently subsidise the use of GnRHA agonists for the purposes of puberty suppression. Most people will need to access health services connected to their local hospital if available. The fertility consequences of gender-affirming hormone treatments are not thoroughly understood, Anecdotally though, some people do cease gender-affirming treatments and have no trouble conceiving. Others appear to be infertile. Some gender-affirming surgical procedures may result in sterilisation. Discussion of fertility with trans people prior to commencing gender-affirming treatment is important for informed care. Information about options for fertility preservation, such as sperm and egg collection and cryopreservation, and assistance with accessing these services is desired by some trans people who seek medical gender affirmation or hormones. However, starting a family after gender affirmation is very possible. Discussions and procedures relating to fertility preservation can exacerbate gender dysphoria, so tread carefully. These are best undertaken with sensitivity, ideally in a healthcare service with experience in this area. Many trans people do want hormone therapy to affirm their gender medically. Testosterone and estradiol to achieve masculinization and feminization of a person's appearance, respectively, are generally safe and effective and acceptable for trans people. The Pharmaceutical Benefits Scheme subsidy for testosterone requires treatment by or in consultation with a specialist in endocrinology, urology, or sexual health. This influences the cost and therefore availability of testosterone for trans people. Testosterone is used for either full or partial masculinization and is generally administered according to protocols used for hormone replacement therapy for those with endogenous testosterone. Estradiol is used for feminization and is generally used in higher doses than for, say, menopausal hormone therapy. Anti-androgen treatment to suppress testosterone is commonly used for trans women and some non-binary people, and progestins might be required for cessation of menses in trans men and some non-binary people too. Other medications may be necessary to augment or counteract side effects of gender-affirming hormone therapy, such as to treat acne arising from testosterone. Hormonal treatment for gender affirmation can and should be initiated by GPs. TransHub can assist here. Guidelines for prescribing hormones and the effects of these hormones are also outlined on the Healthy Male Clinical Summary Guide. Visit the Healthy Male website for more information. About 25% of trans people in the US will seek to undergo some form of gender-affirming surgery. These surgeries may not be available in Australia, but chest surgery is more common than genital surgery for gender affirmation, but at present there's no public funding for gender-affirming surgery in Australia, so the cost is prohibitive for many. Gender-affirming surgical procedures for trans men and non-binary people who are presumed female at birth can include chest reconstruction, hysterectomy, salpingo-oophorectomy, vaginectomy, metoidioplasty, phalloplasty, urethroplasty, scrotoplasty, and testicular and erectile prosthesis. Gender-affirming surgical procedures for trans women and non-binary people who are presumed male at birth can include breast augmentation, facial feminization, tracheal chondroplasty, penectomy, orchidectomy, vaginoplasty, labiaplasty, clitoroplasty. Laryngeal surgery for voice alteration may also be performed. Not all trans people want surgery though, and that's important to know. Preventative health approaches for trans people do need to consider their body, the conventional disease risk factors, and their gender. Tailoring of disease screening and preventative measures is necessary for trans people and is outlined on the Healthy Male Clinical Summary Guide. Some trans people may experience distress during discussions about their anatomy. Physical examinations and screening procedures should be performed by healthcare providers who are aware and considerate of a person's gender. Often, writing to another healthcare provider can alleviate a patient's concern and help them to receive appropriate care. Healthcare providers must bear in mind that regardless of surgery, a trans person's individual characteristics will dictate some aspects of their health and risk of disease, while their gender characteristics may influence other parts of their life. Thank you so much for joining me. Don't forget to check out the range of professional development courses available from Healthy Male and the clinical resources to support your practice. You can find more information and resources on this topic by visiting the Healthy Male website, healthymale.org.au. Be sure to subscribe to the Healthy Male monthly email newsletters for updates.